Hello, my name is Dr. Larry Arbeitman, and I want to thank you for clicking on this video. If you clicked on the video, it oftentimes will mean that either you or someone you really love suffers with migraine headaches. Migraines, or even headaches in general, can be quite debilitating at times. Many people lose days of work. They avoid making social plans as a fear of one may be coming on. And even mothers and dads lose weekends or evenings and afternoons with their kids because they're in a dark room. Now, being an upper cervical doctor, we have taken care of hundreds of people who suffer with migraines and headaches. And what we oftentimes hear is they've gone to other types of doctors who are basically treating symptoms. After the MRIs and the CAT scans come back negative, it's symptom management. A lot of those interventions oftentimes come with side effects such as being zombie-like or lethargic. Now, what oftentimes doesn't happen when people get evaluated for the cause of their headaches is very rarely do doctors look at the cause to the cervical spine. Most people in healthcare these days look at the body in parts, as if the neck and the head weren't even attached. Now, we know that when there's a misalignment or stress to the cervical spine, there's a little bone right up here at the top called the atlas vertebrae. And as an upper cervical doctor, this is the area of the spine that we specialize in. If this top bone in the neck tilts, twists, or turns, it can put compression or pressure on one of three things. It can put pressure on the brainstem, affecting the nerves that communicate from the brain to the body and the body to the brain. It can even put pressure on some of the vascular structures, affecting blood flow to and from the brain. It also can put pressure on the cerebral spinal fluid, the fluid that bathes the brain, and that can back up into the brain. And oftentimes when patients get evaluated, many doctors aren't looking into the cervical spine as a potential cause. Now you may be saying, how could this misalignment even happen? It can happen at any point in life. It can go back to a traumatic birth, all the falls as we were learning to walk, or playing in the playground, or sports injuries, or car accidents, or simply just sitting at a computer for 20 to 30 years, putting stress on the cervical spine. And so we have a unique procedure in chiropractic called upper cervical care, where we don't crack, pop, or twist the spine. The beautiful thing is we can take care of little children who, believe it or not, we're oftentimes seeing with headaches or migraines, all the way up to grandmas in their 80s and 90s. And one of the nicest things about the care that we provide is it's gentle. It's no more pressure than if you were going to check your pulse. And the reason being is because we're very accurate. See, I don't know when a patient first comes in whether or not we can help them simply because they have a migraine. We need to do a thorough consultation to discuss your needs. And then we do an examination. And part of that evaluation is doing sophisticated nerve testing that allows us to see if there's any pressure or imbalance in the central nervous system. We do testing that shows us different colors that appear if there's pressure on the nerves that go to the head, eyes, ears, nose, and throat. Follow-up testing should show that that pressure has been reduced. In addition to the nerve testing that we do, an upper cervical doctor will take very accurate x-rays. These are different x-rays than the standard medical x-rays. They allow us to measure the alignment of the C1 vertebrae, the skull, and the spine below to 1/100th of a degree. And I can tell you, having done over 120,000 of these adjustments over the past 11 years, no two human beings could possibly have the same misalignment, and no two people should get the same adjustment. And when we get this accurate and specific with our analysis, I oftentimes refer to it as having a combination lock to your spine. It allows us to do a very gentle adjustment right here behind the ear to the side of the neck. The most common question people usually say after they get adjusted is, that's it. They just can't believe how light and gentle it is. You know, we've helped hundreds of people with different elements of the cervical spine and headaches and neck pain. And really the first step is to have an evaluation. It makes me think about a young man who came to our office. His name was Peter. He was referred by one of our patients because he needed additional college credits. He was a student at Monmouth University and he was thinking about going to med school. As he was shadowing once a week to gain hours for his credits, he started noticing that we were taking care of so many people who used to be headache and migraine sufferers. He then shared with me that he himself was a migraine sufferer, and oftentimes he would get a migraine in the middle of taking a test. He avoided making plans with friends. He definitely avoided taking long car rides for fear that he would get sick. Once the migraine came, he told me he had to go to a dark room and wait it out. Oftentimes had to take medicine. Oftentimes he had to vomit just to allow the migraine to pass. So we started taking care of Peter. And Peter did so phenomenal under care that it totally changed the direction of his life. I'm very proud to say that as of right now, Peter's halfway through the chiropractic program in Atlanta. He decided to go to chiropractic school so that he could learn upper cervical care and bring it back to the community and help others as well. And there's countless other stories of lives changed through upper cervical care. And I believe it's one of the best kept secrets in healthcare, and it shouldn't be a secret because we know how many people are suffering out there, running out of the number of pills that are allotted in a month. I remember Ken. Ken carried his Topamax prescription with him for 1 year after his last migraine for not believing they were gone. After a year, I said, Ken, I think it's time to throw it away, and he agreed. So again, the purpose of sharing you these stories is because there is hope if you feel like it's a condition that you're just managing for the rest of your life. Now again, I don't know whether or not I can help you, but I will tell you that you're entitled to a checkup, the checkup that I described before. So what I recommend that you do is fill out your information below this video, and I will have Samantha, Stacy, or Kristen, our wonderful staff, reach out to you to set up a consultation. I didn't say an adjustment and I didn't say care. I said a consultation so that you can come in and we can discuss your needs. And if you're really action oriented, just pick up the phone now, call the office, and we'll get you in right away. And I look forward to seeing how we can help you with upper cervical care. Have a great day.